She came into my office carrying a brown paper bag. 70 years old, retired school principal, organized woman, purposeful woman, the kind of person who had run a building of 400 students and 60 staff members for 23 years and never once missed a deadline or forgotten a detail. Barbara sat down across from me, reached into that brown paper bag, and placed a large bottle of apple cider vinegar on my desk between us. She looked at me with complete confidence and said, "I have been taking this every single morning for 6 months, 2 tablespoons in a glass of warm water. First thing, before anything else, I read everything about it, I watched every video, I did my research. I want you to know I am being serious about my health." I looked at that bottle, I looked at Barbara, and I felt the specific weight that I have learned to feel in 10 years of practice when I am about to tell a careful, motivated, genuinely health-conscious patient something they are completely unprepared to hear. I told her we needed to run some labs before we talked further. When her results came back 2 days later, I called her myself rather than having my receptionist schedule a follow-up. I wanted to speak to her directly. Her kidney function had declined, not catastrophically, not to the point of emergency intervention, but measurably, significantly, in ways that did not match her age, her health history, or anything else in her clinical picture except the habit she had just proudly placed on my desk in a brown paper bag. Barbara was silent on the phone for a long moment. Then she said, "But everything I read said it was good for you. Everything said it was one of the best things a person my age could do." I told her that what she had read was not wrong for everyone, but it was dangerously incomplete for her, and for a significant proportion of adults over 60 who are taking apple cider vinegar daily in the amounts that every wellness video recommends, without once mentioning the specific and serious risks that apply to aging kidneys, aging tooth enamel, aging esophageal tissue, and aging bone density. My name is Dr. James Harlow. I have spent 10 years in internal medicine with a focused specialization in cardiovascular and metabolic health in adults over 50. In that decade, I have watched the apple cider vinegar trend grow from a fringe wellness practice into one of the most universally recommended morning habits in the older adult health space. I have watched the videos, I have read the articles, and I have sat across from patients like Barbara who followed that advice faithfully and paid a price nobody warned them about. Today I am going to tell you Barbara's complete story. I am going to explain exactly what apple cider vinegar does inside the aging body that the wellness industry consistently leaves out of its breathless endorsements. And I am going to give you the complete picture, the benefits and the very real dangers, so that you can make a genuinely informed decision rather than a decision based on half the information. Please stay with me through every minute of this video, because several things I am going to tell you will directly contradict advice you have received from sources you trust. And please share this before you finish watching, because right now someone you love is measuring out 2 tablespoons of apple cider vinegar into their morning glass, believing they are doing one of the best things possible for their health. They deserve to know what Barbara learned. Let us begin. Why apple cider vinegar became the most trusted morning habit for older adults. Before I tell you what went wrong for Barbara, I want to do something that I think is genuinely important. I want to acknowledge honestly what apple cider vinegar actually does well. Because this video is not about telling you that apple cider vinegar is poison, it is about telling you the complete truth, the part that gets enthusiastically shared, and the part that gets quietly left out. Apple cider vinegar contains acetic acid as its primary active compound. Research has shown that acetic acid in moderate amounts can slow gastric emptying, which reduces the speed at which food is converted to blood glucose. Several studies have demonstrated modest blood sugar lowering effects in healthy adults following meals. Apple cider vinegar has shown some evidence of modest short-term effects on LDL cholesterol levels in certain populations, and the ritual of an intentional morning health practice carries genuine psychological benefits for consistency and motivation. These are real findings, I am not dismissing them, but here is what the wellness industry does with these findings. It takes research conducted primarily on younger adults, research examining specific doses under controlled conditions, research that explicitly notes limitations for certain populations, and it extracts the positive headline. Then it presents that headline as universal, as applicable to everyone, as something every person over 60 should be doing every single morning without exception. And the research that shows what daily concentrated acetic acid does to aging kidneys, aging tooth enamel, aging esophageal tissue, and aging bone mineral density never makes it into the videos, because that research does not get shares, it does not get likes, it does not produce the feeling of empowerment that drives the wellness content economy. Barbara did her research, she genuinely did, she watched hours of videos, she read articles, she found study after study supporting apple cider vinegar. What she could not find was the other half of the research, because it was never shown to her. Let me show it to her now, and to you. The first thing happening to Barbara's kidneys, every single morning, Barbara's kidney function decline was the finding that sent me reaching for the phone to call her directly. And understanding why it happened requires understanding something about aging kidney physiology that most older adults have never been told. After age 60, kidney function naturally declines. By the time most adults reach their late 60s and 70s, kidney filtration efficiency has dropped by 30 to 40% compared to their younger years. This is expected, it is normal, and it is almost always completely invisible because most people feel entirely fine while it is happening. Standard routine blood tests frequently do not detect moderate kidney decline until it has already become significant. Now here is what happens when you introduce concentrated acetic acid, which is what apple cider vinegar fundamentally is, into a body with declining kidney function every single morning for 6 months. The kidneys are responsible for maintaining the acid-base balance of your blood and body fluids. This is called pH regulation, and it is one of the most critical functions your kidneys perform. Healthy kidneys manage acid loads from diet efficiently and maintain the precise pH balance that every organ system in your body depends on. When aging kidneys with reduced filtration efficiency are presented with a daily concentrated acid load from apple cider vinegar, they must work significantly harder to neutralize and excrete that acid load. Day after day, morning after morning, for 6 months, this chronic acid load in a kidney operating at reduced efficiency creates a condition researchers call metabolic acidosis. It does not have to be dramatic to cause damage. Even mild chronic metabolic acidosis, the kind that produces no obvious symptoms in most older adults, places continuous oxidative stress on kidney tubule cells. It promotes kidney inflammation, and it accelerates the very filtration decline that made the kidney vulnerable to the acid load in the first place. A study published in the Clinical Journal of the American Society of Nephrology documented cases of acute kidney injury directly linked to concentrated apple cider vinegar consumption in adults over 60. The researchers noted specifically that patients with age-related kidney function decline were significantly more vulnerable to acid load-induced kidney stress than younger adults with full filtration capacity. Barbara had no known kidney disease before she began her apple cider vinegar routine. She had no obvious risk factors. She was simply a 70-year-old woman whose kidneys were operating at the reduced efficiency that is completely normal and expected at her age. And 6 months of daily concentrated acetic acid delivered every morning to those already aging kidneys had produced measurable and documented damage. She had been giving her kidneys something she had been told was a health tonic. Her kidneys had experienced it as 6 months of daily acid stress. The second hidden danger. What apple cider vinegar was doing to Barbara's bones. When I shared Barbara's lab results with her in full, including a finding beyond her kidney markers that I had ordered specifically because of her apple cider vinegar use, she went very quiet. Her bone mineral density markers had shifted, not dramatically, but in the direction of accelerating loss at a rate faster than her age alone would predict. Here is the mechanism, and it is directly connected to everything I just told you about acid load and the kidneys. When the body faces a chronic dietary acid load that the kidneys are struggling to fully excrete, it activates a compensatory buffering system. The body draws calcium from bone tissue to neutralize the excess acid in the blood. Calcium is alkaline, it counteracts acid, and bone is the largest calcium reservoir in the human body. This process is called acid-induced bone resorption, and in older adults who are already at elevated risk for osteoporosis and bone density loss, simply from age-related hormonal changes and reduced calcium absorption, chronic daily acid loading from apple cider vinegar accelerates bone mineral loss in a way that significantly amplifies existing risk. A study published in the journal Osteoporosis International examined the relationship between chronic high-acid dietary loads and bone density in postmenopausal women over 65. The findings were clear and concerning. Higher chronic dietary acid loads were associated with meaningfully accelerated bone density loss compared to women with lower acid dietary burdens. The researchers specifically identified concentrated acidic beverages consumed regularly as a significant contributor to this effect. Barbara was 70 years old. She was postmenopausal. She was already in the demographic most vulnerable to bone density loss. And every single morning, she was delivering a concentrated acid load to her body that was triggering a calcium withdrawal from her bones to compensate. She thought she was doing something wonderful for her health every morning. Her bones were paying a price she could not feel and would not discover without specific testing. I want to be clear that reversing bone density loss is a slow process, even under ideal conditions. Preventing it from accelerating is significantly easier than reversing it once it has progressed. This is exactly why the complete picture matters so much for older adults making daily health decisions. By the time you feel the consequences of accelerated bone loss, You have already lost something very difficult to recover. The third hidden danger. What 6 months of daily acetic acid was doing to Barbara's esophagus and teeth. Barbara mentioned at our follow-up appointment something she had not thought to connect to her apple cider vinegar routine. She had developed a persistent mild burning sensation in her chest and throat that she had attributed to acid reflux. She had been taking an over-the-counter antacid for it for several months. She had mentioned it to her previous physician, who had told her to continue the antacid and see if it resolved. Nobody had asked her when it started. It had started approximately 6 to 8 weeks after she began her daily apple cider vinegar routine. Apple cider vinegar has a pH of approximately 2.5 to 3. For context, battery acid has a pH of approximately 1. The natural pH of your esophagus is designed to handle food and mild digestive acids transiently. It is not designed to handle repeated daily direct exposure to a substance with the acidity of apple cider vinegar. When undiluted or lightly diluted apple cider vinegar is consumed regularly, it comes into direct contact with the mucosal lining of the esophagus. In younger adults with robust mucosal cell turnover and repair capacity, this exposure causes irritation, but the tissue recovers relatively efficiently between exposures. After age 60, mucosal cell turnover slows significantly. Esophageal tissue repair takes longer, and the protective mucous lining of the esophagus becomes thinner and more vulnerable. Daily acid exposure under these conditions does not fully heal between doses. The irritation accumulates, chronic esophageal inflammation develops, and in some cases, over months and years of continued exposure, this chronic inflammation can progress to more serious esophageal tissue changes. Barbara's chest burning was her esophageal lining communicating. She had been suppressing the message with antacids, rather than removing its cause, because nobody had told her that her health tonic was the source. And her teeth. At Barbara's 6-month dental visit, her dentist had noted increased enamel erosion compared to her previous visit. He had asked her about acidic beverage consumption. She had not thought to mention the apple cider vinegar because she did not think of it as an acidic beverage. She thought of it as a health supplement. Tooth enamel does not regenerate. Once it is eroded, it is gone permanently. And the acid in undiluted or lightly diluted apple cider vinegar is strong enough to cause measurable enamel erosion with regular direct contact. Research published in the Journal of Clinical Dentistry documented significant enamel erosion in adults who consumed apple cider vinegar drinks regularly, with erosion severity directly correlating with frequency of consumption and concentration of the vinegar solution. Barbara's morning health ritual had been simultaneously stressing her kidneys, accelerating her bone mineral loss, inflaming her esophagus, and eroding her tooth enamel every single morning. For 6 months, while she felt proud of her discipline and her commitment to her health, she was not careless, she was not irresponsible, she was a careful, motivated, intelligent woman who had been given half the information, the fourth hidden danger: apple cider vinegar and blood pressure medication. There is one more layer to Barbara's story that I consider critically important, and that applies to a very large proportion of older adults who are currently taking apple cider vinegar daily. Barbara was on a potassium-sparing diuretic for mild blood pressure management. This is an extremely common medication in adults over 65. Potassium-sparing diuretics work by reducing the amount of potassium the kidneys excrete, helping to maintain adequate potassium levels while managing fluid and blood pressure. Apple cider vinegar affects potassium levels in the body. Chronic acetic acid consumption has been shown in multiple case reports and studies to contribute to hypokalemia, which is abnormally low potassium in the blood. The mechanism involves the metabolic acidosis I described earlier, combined with altered kidney handling of electrolytes under chronic acid load conditions. Low potassium is not a minor inconvenience in an older adult. Potassium plays a direct and critical role in the electrical stability of the heart. Even modest potassium reductions below the optimal range begin to affect cardiac rhythm. They increase the risk of dangerous arrhythmias, they cause muscle weakness, they cause fatigue, and they interact unpredictably with certain blood pressure medications, including the class that Barbara was taking. A case series published in the International Journal of Obesity documented multiple older adults who developed significant hypokalemia and associated cardiac symptoms directly linked to chronic apple cider vinegar consumption. All of the affected patients were taking medications that further complicated their potassium balance. Barbara's potassium level on her lab panel was at the low end of the normal range, below optimal. In the context of her potassium-sparing diuretic and her 6 months of daily apple cider vinegar, this was a finding I took very seriously. Her morning health tonic was interacting with her heart medication in ways that her cardiologist, her previous internist, and her pharmacist had never identified because none of them knew she was taking it daily. She had not told them because she did not think of it as something that needed to be disclosed. It was not a medication, It was a food. A health food. Something she had bought at the grocery store. This is one of the most important points I can make in this entire video. If you take any prescription medication and you are consuming apple cider vinegar regularly, please tell your doctor, today, not at your next scheduled appointment. If that is months away, call the office, tell them, the interaction may be manageable, but your doctor cannot manage an interaction they do not know is happening. What the wellness industry is not telling you. I want to step back from Barbara's specific case for a moment and address something that I think needs to be said directly. Apple cider vinegar is a product. It is sold, it is marketed, and the content ecosystem that surrounds it, the videos, the articles, the testimonials, operates within an economic reality where positive content about a popular product gets watched, shared, and monetized, and negative content about the same product does not. This does not mean that everyone promoting apple cider vinegar is deliberately deceiving you. Many of the people making that content genuinely believe what they are saying. They have read the positive research, they have experienced or observed apparent benefits, they are sharing what they understand to be true, but they are sharing incomplete truth. And for a 70-year-old woman with aging kidneys, age-related bone density vulnerability, a sensitive esophageal lining, and a blood pressure medication that interacts with potassium, incomplete truth is dangerous truth. The research on apple cider vinegar benefits was conducted predominantly on younger adults without significant organ function decline. It was conducted at specific doses, under controlled conditions, with monitoring. The research on its risks in older adults with declining kidney function, medication interactions, and age-related tissue vulnerability is real. It is published in peer-reviewed journals, and it is almost completely absent from the wellness content space. You deserve both halves. That is why I am here. That is why this video exists. What Barbara did next, and what you should do right now. When I explained everything I have just shared with you to Barbara over 2 appointments, she went through something I have watched many careful older patients go through. First disbelief, then a particular kind of grief for the habit she had been so proud of and so committed to, then a quiet and growing anger directed not at me but at every source that had recommended this to her so enthusiastically without once mentioning what it could do to her kidneys at her age, at her bones, at her esophageal tissue, at her teeth. She stopped her daily apple cider vinegar immediately under my guidance. We implemented a specific monitoring and recovery protocol, regular kidney function testing, every 8 weeks, bone density baseline imaging, esophageal symptom tracking, potassium monitoring in conjunction with her cardiologist. Over the following 5 months, her kidney function markers stabilized and began slowly improving. Her chest burning resolved completely within 3 weeks of stopping. Her potassium level normalized. Her bone density testing gave us a baseline to monitor going forward. She called my office at her 6-month mark after stopping. She said she felt better than she had in most of the previous year. She said her digestion felt calmer, her energy was more consistent. The low-grade nausea she had experienced most mornings, which she had never connected to her vinegar routine, was gone. She also said something that I want you to hear directly. She said she was angry that something so widely and confidently recommended had been so incomplete in what it told her. She said she felt that older adults deserve better than half the information dressed up as expert guidance. I agree with her completely. That is why I made this video. Here is what I want you to do right now, based on everything you have just learned. If you are over 60 and you take apple cider vinegar daily, please schedule a conversation with your doctor before your next dose. Ask for a kidney function panel, including creatinine and EGFR. Ask for a potassium level. Tell your doctor exactly how much you are taking and for how long. Do not assume they already know. Disclose it the way you would disclose a new medication. Because in terms of its physiological effects on your aging body, that is effectively what it is. If you take any blood pressure medication, any heart medication, any diuretic, or any medication that affects kidney function or electrolyte balance, treat this conversation as urgent. Call the office. Do not wait for your next scheduled appointment, if that is months away. If your dentist has mentioned increased enamel erosion at recent visits, and you have not connected it to apple cider vinegar consumption, connect those dots now and share them with both your dentist and your physician. And if you experience chest burning, persistent throat discomfort, or unusual fatigue after beginning an apple cider vinegar routine, please do not reach for an antacid and continue. Please talk to your doctor and consider whether the tonic is the source of the symptom rather than a coincidental condition requiring separate treatment. If after a complete conversation with your physician, you decide together that a modified version of apple cider vinegar consumption is appropriate for your specific health situation, here are the harm reduction principles that the research supports. Never consume it undiluted. Always dilute significantly in a large full glass of water. Never consume it on a completely empty stomach. Always drink it through a straw to reduce direct tooth enamel contact. Rinse your mouth with plain water immediately after, and consider reducing frequency from daily to 2 or 3 times per week to reduce the cumulative acid load on your kidneys and esophageal tissue. But I want to be honest with you. For many older adults with declining kidney function, existing bone density concerns, esophageal sensitivity, or medications that interact with potassium balance, the most protective choice may simply be to stop entirely and find the specific benefits you are seeking through alternatives that do not carry these risks for your specific body. What I want you to carry from Barbara's story: Barbara was not reckless. She was not naive. She was a retired school principal who ran a large institution for over 2 decades. She was one of the most organized and research-oriented patients I have ever treated. She was simply working with half the information, the half that gets shared, the half that drives engagement and enthusiasm and sales, the half that feels empowering and simple and universally applicable. The other half, the half about aging kidneys and bone mineral loss and esophageal tissue and medication interactions, was sitting in peer-reviewed journals that the wellness content economy had no incentive to surface for her. She placed that bottle of apple cider vinegar on my desk with pride. She had earned that pride through 6 months of disciplined daily commitment. She deserved to have made that commitment with complete information from the very beginning. You have that complete information now. Use it wisely. Use it to have a better conversation with your doctor than Barbara was able to have before that Tuesday morning appointment. And please share it. Because right now, someone is watching a video telling them that 2 tablespoons of apple cider vinegar every morning is one of the best things a person over 60 can do for their health. And that video will not show them what Barbara's lab results showed me. You can be the person who shows them the other half.